And welcome back to another episode of Aesthetic Revolution, the podcast. I'm Ed Zimmerman, your host. My co-host, Staci Taylor Zimmerman. And today we're going to do a series of rapid fire, if you will, questions that are the most asked of what we see across our social media platforms, especially on TikTok stuff. So while we usually discuss from forehead to feet with a concentration in between, today's going to just be the in between. So, Staci,
right.
Ask away.
All right. Foreskin or not?
Foreskin or not? Maybe.
So, I don't want to hear that.
Well, but you don't have to have the foreskin removed, but you can have the foreskin removed for religious reasons and occasionally for medical reasons. If you have a child who isn't able to wash well, the foreskin doesn't pull back easily, there's adhesions, there's tethers, or getting chronic bacterial, fungal infections, things like that, or adults. We certainly do circumcisions on adults too. The foreskin may either need to have a dorsal slit just to open that tissue up a little bit so it can pull back, not get stuck, and then reduce over the tip of the penis. Ostensibly, that improves sensation of the tip of the penis from protecting it from trauma, irritation, sensation, whatever. That foreskin was put there by nature for a reason. Other members of the animal kingdom have it, so there's probably a good reason that foreskin is there, but it's probably a protectile element. But at times, it gets in the way, and sometimes there's too much foreskin. At times, people don't do a good job of reducing the foreskin, and it can cause tethers and adhesions of its own, so it foreshortens the penis, and in a grower, the penis may not be able to extend the full length when it's erect because of a poorly done circumcision. So that has to be adjusted as well. But, I think the majority of people, it's going to be a familial thing. Dad has a foreskin. Kids will probably keep the foreskin, make that decision when they get older. Dad doesn't have a foreskin for whatever reason. Kids are probably going to want to look like dad and their older brothers or what. And, I don't know that it makes a whole lot of difference. We've certainly asked our audiences, does it make a difference in sensation? And certainly the guys we do adult circumcisions on, when we've asked them, is it too sensitive now that the foreskin is removed? Or is it as sensitive? Over time, it hasn't seemed to make a lot of issue.
Yeah, that's for the most part. So if it works and everything's fine, keep it. If something's going on with it, you can certainly have it.
You can release the adhesions. You can put a pleat in and let it open up, or you can remove the whole thing and expose the whole gland of the penis, and life goes on.
Okay. So, does length really matter?
Does length really matter? Well, the average stretched length or erectile length, depending on genetic predisposition and ethnic heritage and stuff. And it's arguable because there's a standard or two deviation above and below, but average 5.5 inches in most references. Depending on the depth of the vagina, the Virginia of the partner, that as women engorge, if you allow the time for the vagina to the tube of that to engorge, and for the uterus and the cervix to move around, because it was all based on Mother Nature trying to dip the cervix, if you will, into the pool of waiting semen to continue the species. Mm-hmm. But as things tighten up, that can get shorter. The cervix can get beaten up by the tip of the penis. That's why the tip of the penis isn't as hard with an erection as the sides of the penis that cause the erection. And, it can be uncomfortable for the gal. Now, some gals enjoy that. So, if they pick their position, maybe they can control the depth of penetration by being on top or whatever. But, if they don't enjoy that, they can make sure that it doesn't happen. The sensation, more of the active nerves of sensation that lead to climax and orgasm in a woman are in the first 2 inches of the outside of the vagina. So where the clitoris is on the outside and where the Grafenberg area is on the dorsal aspect on the inside is within the first couple of inches of the vaginal canal. So girth is probably more important than length, except in guys' minds. So right. in the pornography industry and in guys' minds and in gray sweatshirt parlance, length may be important, and we can talk about growers versus showers. But the reality is that while there are certainly guys that are well over 5 or 6 inches, there are certainly guys that we've seen who are well under, and under 3 inches as an adult is considered a microphallus. So 2.5 standard deviations less than quote unquote normal, 5, 5.5, maybe 6, depending on who you read, is felt to be a micro penis. So when you put it on stretcher with erection, if it's under 3 inches in an adult.
Mm-hmm.
So, and then with kids, they have various other scales and stuff. So the moms who are worried is my child long enough?
Mm-hmm.
If they're worried, they can look up the scales online, or they can go to their primary care practitioner and make sure that things are okay. But generally they are. It's something that's, golly, 4 to 6% or less of the population really truly has a microphallus. The rest are just fat or not as well endowed or have significant extra foreskin or whatever. And it's just a matter of getting them through puberty where that tissue gets enough testosterone to make it grow and blossom, as it were.
Mm-hmm. So what's the average girth?
The average girth is probably a little over 3.5 to 4 inches at rest. And then when you add erection to it, probably another inch. Now, it's not to say that we don't have guys who are a little bit less. We've certainly added volume to guys who are, 2.5 inches sometimes. Mm-hmm. They're very much at rest. It's the George syndrome on Friends. And so by the time they come to see me, new doctor, new surroundings, somebody's putting anesthesia near my man parts, they shrink right up, but they blossom. The good news is they blossom. And, certainly growers are guys who aren't engorged most of the time under certain circumstances. They're just not fulfilled. And when they need to fill, and they have an erection, they come up to their full potential, and they can be just as big around or as long or both as showers. It's just showers are more engorged more of the time. And that just depends on the guy. Mm-hmm. They both work. They both work fine. And growers don't grow a lot more because they're already partially engorged. So once they get fully erect, they grow a little bit more. Mm-hmm. But you can't get any longer than Mother Nature made you in general. There are ways to stretch things out for a bit of time. But it's not like we can add girth in the office. When we add girth in the office, they can get a long-lasting
right.
girth enhancement that they get to keep for months, years,
right,
lifetimes.
Yeah, exactly. Okay, one of the questions we get all the time is, do the gas station pills help you gain length?
The gas station,
long-term length is what they want. They don't want a pill for long-term length.
Yeah. Well, if it worked, we'd all be doing it.
Right.
So that's part of the. If it sounds too good to be true, it probably isn't. Those are the trite answers. But the reality is that the gas station pills don't have the Viagra, Cialis, Levitra type medications in them to cause improvement in erection. So the resting girth or chubbiness isn't improved. They may have some horny goat weed or some DHEA or some of the other things that are rumored to improve a little bit of erection. They may have nitric oxide activators and things. So they may improve things a wee bit, but it doesn't have the FDA-controlled prescription-based medications.
And that's just for an erection temporarily.
Yeah. It doesn't make you grow length.
That's right.
It doesn't make you any bigger.
To grow your penis.
Any more than I can take a pill to make me taller.
Okay. Another question.
Or smarter.
When does my penis stop growing?
So the penis stops growing, good question, around the same time that your bones seal off. So once you've achieved as much height or arm length as you're going to get, your penis pretty much stops growing. Now, you may get more girthy, you may get more volume, and that's a moving target, again, depending on erectile function and whether you're a grower or a shower. But the length of the penis is the length of the penis. There are technically some ways of trying to make the penis longer temporarily. Jelqing is a thing we've discussed on social media and maybe a podcast before.
Another question that is asked a lot. Does that work?
So does jelqing work? Jelqing is a form of careful stretching of the penis throughout the day, a lot. And if you go to the fallow boards and forums and things, yeah, I think it does work to a degree. And when you stop, it's not usually maintained over a long time. There are also devices that you can push up against the pubic area around the base of the penis and then sort of suction cup onto the tip of the penis, and you can stretch the penis almost like you're quartering it. But remember, if you draw too much, you're going to embarrass or damage the nerves and potentially decrease sensation. You're going to embarrass or damage or stretch the vascular chambers of the corpora cavernosa and corpora spongiosum. So think about it. If you have a balloon that's about yay long, that's about a foot between my hands now, and maybe 6 inches around, and you stretch it, now it's 2 foot long, what happens to the girth? It has to get smaller. So if you're stretching your penis long, in terms of strict volume, it tends to get smaller around. Now, if there's irritation or inflammation involved, you may actually maintain girth or get a little bit of temporary improvement in girth by stretching. It's certainly in the literature. But it doesn't tend to last long. It tends to go away when you quit doing it. You could also do some of that with a good vacuum pump. So whether it's an air-based pump or a water-based pump, you can have the discussion about which one works better or whatever. Either way, you're still maximally engorging the penis, and I like it because it takes the penis to the gym, and so it teaches it maximal engorgement. You can keep it without hurting, so that it learns to stay engorged for a while. And that can be done as a training exercise, or it can be done before lovemaking.
Versus jelqing is very different.
Very different.
So let's go back to the jelqing.
Because you're not erect when you're jelqing, generally.
Right. So you're basically just stretching out that tissue.
Yep. So think about stretching your finger.
time,
if you pull on your finger all day long, you can separate the joints and you can make the finger a little bit longer. But when you quit doing it...
Well, the damage that you're causing to the joint and to anything...
Potentially.
Potentially. And we have seen patients that have been longtime users of some of these devices, and they have some severe...
They have some issues. They come in for erectile dysfunction or loss of sensation.
And we're not sure if that could be causing it, because sometimes these guys don't follow the directions of how to use it.
Guys not follow directions? Could that ever happen?
Oh, no.
No. Tell me it's not true.
They don't use directions. They throw them out.
Yeah.
But
Too much of a good thing.
Right. Yeah. Too much of a good thing is usually a bad thing. So in that case, it can be. So we just want to make sure that we advise people to use it responsibly and not, every day, several times a day for years on end. And that could be a problem.
Yeah. And there's always going to be an outlier who goes, no, I've been doing this for years. I've absolutely improved 1/2 inch, 1 inch, whatever it is they claim. But, it's the same thing as being on what I call a teeter board, one of these inversion tables. If they could really make us taller for any extended length of time rather than just separate the vertebrae a little bit, people would be sleeping in them. And we don't as a civilization. And you think about people who do well in civilization tend to be taller, male and female, but they tend to be taller rather than shorter as a rule. They tend to have stronger jaw lines. We address that with other issues surgically or with fillers and things, implants. And so if you could do those things, if those were desired for success in life, people would hang upside down and find ways to stretch their jaws forward every night as they went to bed, and we don't. So no one's found a good way to do it that's long-lasting. It requires a surgical intervention or other way of making a long-lasting change that's safe.
Right. So let's talk about testosterone. Optimizing testosterone. We get this question a lot. We always will tell people, first thing you need to do is, have those levels checked. They get the levels checked, and many, many, many times their primary carers tell them, you're fine.
Yeah.
And they're very low. So let's discuss that, because that's a lot of patients out there.
Yeah. So unfortunately, the fallacy is out there that if you're in the normal range, and depending on the lab, the normal range for total testosterone versus free testosterone, which is actually the active form, and we can discuss that a little bit. But total testosterone as a screening tool, you'd like to be near the upper end of whatever the range is, the top 20 or 30% of whatever the range is from that laboratory. That's where most people are when they're in their mid-20s to early 30s. So if a laboratory has a range of 250 or 300 to 900, say, you'd like to be in the 7, 8, 900 total testosterone range for most of your life. Mm-hmm. Testosterone does not cause prostate cancer. So the things that we, people as old as I am, were taught in medical school was that prolonged exposure to testosterone causes prostate cancer. It's absolutely not true. It has been disproven. Testosterone will cause the prostate to grow over time. If there's a cancer in the prostate, it'll cause it to grow more over time. But that's something that can be monitored these days. And we still lose people to prostate cancer. It's an indolent cancer, but it takes years and years to take people out. I'd rather be on the testosterone.
Aren't most prostate cancers very slow growing?
Generally, yes. Yeah. The majority of them are, but they can metastasize, and they do kill people. They kill many people and many guys every year because it's hard to screen. Mm-hmm. It's not just putting a finger up the butt or checking a prostate-specific antigen. It can be kind of a little hidden gem or surprise. So, and we don't, prostates are not on the outside of the body, so we don't screen for them like we do mammograms and make recommendations. And, the pendulum is swinging the other way. We probably were over screening for prostate and doing too many biopsies and things for a number of years. And, if you're a guy and you hang out on this earth long enough, your prostate's going to enlarge. You're going to have a little harder time passing your urine when you want to. You're going to produce less semen in your ejaculate. So the normal ejaculate's 3 to 5 cc's or mLs, about a teaspoon or a little bit less. It's going to get less as your seminal vesicles involute and dry up. A number of things are going to happen. But when guys come in and they want a P shot, a platelet-rich plasma injection to their corpora cavernosa to make the corpora engorge better and to make the nerves improve and sensation to be better with an erection, I tell them, look, the best P shot in the best of hands, the best of genes, and the best of days may not work as well as it could unless your testosterone is optimized. And optimized, even in older individuals, we'd like to get them into that upper third of total testosterone. And then make sure that they don't have issues with blood pressure or overproduction of red blood cells that predisposes them to stroke or heart attack or issues like that. We want to use it as a natural antidepressant. We want to use it as something that keeps the penis working and the erections working, even if the testicles get lazy and get a little smaller. We can protect them if we need to. We need to protect against peripheral conversion of testosterone to estrogen, which can happen in guys, particularly if they have a little fat on their bodies. That happens more in peripheral fat. So we put them on an anastrozole, super cheap medication, minimal side effects in the doses that we use. It protects them from getting bitch tit and the feminizing results of too much testosterone. Mm-hmm. We want to protect them from steroid rage. We want to protect them from male pattern baldness and things like that. So high testosterone is an issue, but optimal testosterone really helps all the other things that we do work, and you get to keep your bone mass, your muscle mass. There's a lot of reasons to be on testosterone. Okay. Or at least check it.
So if someone goes and has their testosterone checked and their primary care says, oh, you're fine, but it clearly is low, what should they do?
I think if they're symptomatic and they probably had a concern to ask it to be checked, then they need to find a doctor who's a little better informed in this particular area. And we find when we screen for male labs, we also check thyroid. We make sure they've got enough active thyroid. We check the prostate-specific antigen. We check the liver function because that's where testosterone is broken down and built and things like that to a degree. So we check a lot of other things, red blood cell count, and we look to make sure that those things are working well before we put someone on testosterone. And we check them every 6 to 12 months to make sure that we are safe to continue them on testosterone. Testosterone is a controlled substance. It's Schedule 2. And so you can only write for 6 months at a time. And it's generally either as a gel or a cream. So when you rub this in, usually at the same time each day, I tell people to use it after the shower so the pores are open. They can rotate the sites if they want to, but they have to be careful if they cuddle, because some of that testosterone can get to their partner, which may or may not be a good thing. So also injectable testosterone can be done in the muscle. It can be done sub-Q. It could be done 1 or more times a week. You can do little mini doses. And, we talked about anastrozole and protecting them from peripheral conversion, testosterone to estrogen and things like that. We can use HCG, human chorionic gonadotropin, to protect testicular size if that's an issue. It doesn't seem to be a major problem unless it would be causing reduced fertility in guys who are trying to become dads.
So there's lots of things we can do. I mean, just optimizing that testosterone, checking it every 6 months with blood work.
Yep, 6 to 12.
That's it.
And just recognize that the things that go hand in hand with that, with testosterone, often goes thyroid, often goes other parts of our metabolic function that we need to check and make sure that we're running well to optimize all the effects.
All right. So another thing that is, we always hear this one is the curve in my penis normal?
Yeah, a curved penis, either at rest or with erection, can be normal. It only becomes problematic if it's over about 30 degrees. So if you figure that if you have a horizontal and a vertical, and there's 90 degrees. If you bring it halfway to the side, equidistance, that's 45 degrees. So a little less than that is 30 degrees, 45 divided by 3. So you drop it another third. So 30 degrees is a pretty significant angle that might make it challenging to have relations in some people. Less than that, generally, they'll find a way. They'll find a position or two that works for them, and sometimes that can be very popular. It hits all the right points, as they say.
We've heard that on our social platforms. A lot of women have said, "I love it. I think it's great. It does."
Yep. And recognize that the penis is sort of a three-legged stool. If you cut through the shaft of the penis, so that you have the length of the penis, and you cut perpendicularly through the shaft, you'd see 3 major chambers. The top 2 are the corpora cavernosa. Those are the hydraulics of the penis that stretch from under the pubic bone all the way out to the tip of the penis, the glans penis. And then underneath, in the center, containing the urethra, the tube from the bladder out to the meatus, the opening on the outside, is the corpora spongiosum. That one doesn't get as hard, so you're able to ejaculate or pass urine, even if you have an erection. But if any of those 3 legs get trauma, and one leg has a little condensation, a little scar tissue, a little, it's not as long as the other 2 legs, there's going to be a tilt to the kilt. There's going to be a rotation of the straight shaft in the direction of wherever the shortened leg is. So it can be up, it can be sideways, it can show more at rest, it can show more when it's erect. These are all variations of normal, and they're very, very, very common.
That's the one thing I think that is surprising, I think, for me, is that how common it is. I mean, it seems to be,
Yeah. Now, if it's affiliated with pain, then, and you can feel a plaque under the tissue, then we talk about something called Peyronie's disease or Peyronie's syndrome. And that's actually a condensation of scar tissue that's often treated with a collagenase, so it's something that dissolves collagen. Think of it as a keloid on one of your corpora. And so it causes that contraction of the corpora there. And there's ways to dissolve it to help it relax. So you can help it relax. You can do injections of collagenase. You can do injections of what was originally a cardiac medicine called verapamil. We can use platelet-rich plasma. We can put the penis in a splint, a vacuum splint, if you will. So vacuum pumping to help things pull straight, or one of the many other ways of straightening things out, or even just wrapping it with a non-stick dressing during the treatments. And there's usually a minimum of 3 that insurance will cover about a month apart as far as injections with collagenase or verapamil. Those are done by your urologist. to help straighten things out and reduce the pain. If it doesn't hurt and you can use it, leave it alone. We can only make it worse.
It's not broke, don't fix it. Right?
Yeah, because the way they used to try to make this straighter is, if you've got a 3-legged stool, rather than make the one leg longer, they'd cut off one of the other legs. So they made the whole stool sit closer to the ground. So they made the whole thing shorter. Nobody wants to foreshorten their Johnson.
Right. Well, I think we've answered, I think, most of our top questions that we get every day.
Yeah,
multiple times
we get lots
a day
of other ones,
but yeah, these are some of our top ones.
Okay.
That we always seem to get. But
all right, so thanks for listening to another podcast of Aesthetic Revolution, the podcast. Like, look, listen, share, ask questions. We get lots of those. We appreciate you. Tune in, and we'll do some more rapid fire questions for the Dick Doc and the other ones in between, and looking for all things aesthetic between the forehead and the feet. We'll see you next time.